too often, Louisiana finds itself near the bottom in the nation when it comes to a variety of health factors. We're second in the nation for the highest rate of obesity and near the top for the number of people with heart disease and cancer. A number of factors play into why Louisiana as a whole is so unhealthy. To close out our Life Pulse series this month, health expert Dr. Ronnie Whitfield shares insight on improving these outcomes. In this episode of Life Pulse, we're going to do a checkup of sorts on Louisiana health rankings. And joining me is Dr. Ronnie Whitfield, aka the hip hop doc, social media sensation, here to share with us your expertise and insight. Louisiana, as we know, tends to be first on all the lists that we shouldn't be and last on all the lists that we should be. When we come to health rankings, this could not be more true, right?
Yeah. When America catches the cold, Louisiana catches pneumonia. We're at the bottom of the barrel when it comes to heart disease, obesity, literacy. We're not doing very, very well. And this has been going on for many, many years. There's definitely strong attempts to try to correct these things, but we just can't seem to get out of that barrel. And I see it daily in my office. Heart disease, chronic diseases, diabetes, hypertension, strokes, heart attacks, many of these things preventable and treatable, but there's reasons why that happens in our community.
So we know that we have some of the highest cancer rates in the nation,
Right.
AKA Cancer Alley.
Yes, ma'am.
What other health indicators are of concern to you in the state of Louisiana?
Again, high rates of hypertension, high rates of obesity, high rates of diabetes, and then the preventable things, well, obesity is one of those in a sense, but cigarette smoking. The levels have declined some, but we still have a significant amount of people that smoke cigarettes, and substance abuse. This fentanyl crisis is taking the lives of our young people. So another huge issue that I think is a topic we should delve into as well later.
What is going on with our citizens? What is happening? Is it an economic thing? Is it a jobs and opportunity thing? Is it a lack of access to quality food?
Keep going.
All of the above?
Multifaceted, lack of access to care, high rates of poverty, all of those things contributed to the poor health conditions of Louisianans. And it's not an easy fix from the policy level to just a local level. What could be done as community activists? There's attempts to do natural food gardens and to grow foods. There's a very interesting book I read by author Michael Pollan that says, if you can't see your food from the field to the table, or read less than 5 ingredients on the label, I think he said 3, you probably shouldn't eat it. We have a highly industrialized food process now, much of this food is made. And of course in Louisiana, we celebrate everything with food and alcohol. And again, most of this food is not really, really good for us. It's full of sugar, salt, and fat. It tastes good for a reason. It's almost addictive to a sense. And so we've got to learn ways to control that part. So from a political standpoint or from a legislative standpoint, putting policies in place that can protect folks. There's been limited success with size and quantities of foods and taxing cigarettes and that type of thing. But collectively, we can come up with some ideas that could improve this.
So definitely at the policy level, we can make some substantial changes to improve our health outcomes.
Right.
What can we do from a personal responsibility level here as a Louisianian?
And there's some self-ownership we have to take. Some folks just don't have access to the walkable neighborhoods, the bikeable neighborhoods, the food deserts that they just don't have access. The corner store is more popular in some communities than the grocery store. And then even knowing that when you're in the grocery store, on the outer parts of the grocery store is where it's healthier than going to the internal parts of the grocery store. So there needs to be some robust education in the communities coming from the physicians when people have access to care and can get that education. Food nutrition programs in our school would be very, very important as well. And so there's cradle to the grave marketing. Our young people are being marketed to when they come out of the grave to eat cereal, which is like candy in the morning. And so we've got to change as a paradigm shift has to happen. We have to change how we think about how we eat. And Louisianans tend to, we don't just love to eat, we eat to live. And so instead of eating to live, we need to live to eat, And so, well, maybe I said that vice versa. We should live to eat and not eat to live.
As a doctor, what are the most common health concerns and ailments that you see and that you treat that are you feel are the biggest issues?
Heart disease. It's the number one killer of all Americans, and most of the heart disease we see is preventable and treatable. And what goes with that, hypertension is a form of heart disease, diabetes, I just named them, COPD. These are, for most parts, preventable and treatable forms of illness. Obesity is the single most preventable cause of death in our country. Seems to be slowly overtaking cigarette smoking, the number one single most preventable cause of death. So again, making some healthy choices. You know, we worry about the wars and crime, but what's killing us more than anything? Heart disease. And so we could just stop heart disease alone. You know, during the COVID pandemic, there was a lot of things that happened as well, and we thought COVID may have been causing cardiovascular problems. And it at one point was in the top 5 for number 1 killers of cause of death, but we still have those same things at the top. Cardiovascular disease, strokes, diabetes, they're still up there.
In a perfect world, what would you like to see as a medical doctor? What if you could pick the top 3 things that we could do to turn the state of our health around? What would it be?
Wow, tough question because there's so many. Definitely addressing accessibility to healthcare and to healthy foods. I mean, that would make a huge difference. But on top of that, the education piece to let people know about the healthy food choice they make. Many folks don't understand that food is industrialized. There's a place in New Jersey, the New Jersey Turnpike, where food is made. The same place where they make chemicals, they make food additives. And so we're not really eating what's healthy. So I would love to see people eating more organically, eating things that come out of the ground, things that you can see, less processed food. So reducing the amount of processed foods and, of course, being more active. Again, the average American gets 3,000 to 4,000 steps a day. We should be at least 5,000 steps a day. Getting some natural, fresh sunlight and exercising on a regular basis.
All right. Well, Dr. Ronnie Whitfield, thank you so much for joining us on this episode of Life Pulse. Encouraging information in the sense that there are things we are empowered to do to improve our health outcomes, and important information that the public needs to know to push for changes at the policy level as well.
Yes.
All right.